Hello, my name is Kimberly Jones. I'm a nursing student at UT Arlington's graduate program in the Nurse Administration track. I wanted to speak with you today a little bit about proper documentation in a anesthesia Pyxis machine. I'll put this up here. So we'll talk about the accurate charging and documentation, and just a little bit of background of this for you. As you know, all the federal guidelines as far as CMS, Joint Commission, and all the regulatory bodies require us as health professionals and providers to make sure that we're accurately charging our patients, because otherwise, if we do not give time and attention and have good ethical and moral standards in regard to this, we could possibly be committing a crime, which would be fraudulent, to charge our patients for medications that they didn't receive. And it's also required of us to do our due diligence to properly waste and transfer, and to also reconcile medications, and particularly as it is in regard to narcotics or scheduled drugs as well. So we'll talk a little bit about that as well. So I wanted to go over the program objectives. There's several, but for the purpose of this short video, I wanted to state what the program objectives would be. To understand the importance of accurate charging and documentation of drugs pulled from an anesthesia Pyxis machine. Be prepared to practice with your preceptor the concepts of signing out medications, returning unused medications, wasting medications, both scheduled drugs and unused or tampered medications, and transferring unused medications from one patient to another in the event of a canceled case in the operating room. So our projected program outcome, really in a nutshell, for all of these things that we're going to talk about today, is for the student to be able to avoid drug discrepancies based on a better understanding of charging and documentation in both the Pyxis and the electronic health record. So I have just a few photos here to show you. The surgical bedside Pyxis machine that we have in the operating room, it's really been a very huge help to anesthesia providers over the last few years, because before we would go just like to the nursing station type Pyxises that were out in the core hallways in a surgical area. But now in many of our institutions, we're fortunate enough to have these small Pyxis stations in each one of the operating rooms, so that when you come in, you can sign into your patient. And we have bioidentity, so it's not just anymore using a code, but you can also use your fingerprint, so it's a little bit more secure means of checking in and out. We've actually set ours in the operating room at UT Southwestern so that it will time out after about a couple of minutes once you've signed in, and it also automatically times out, so if someone else needs to get out a narcotic, or a narcotic in general needs to be pulled, it requires that someone re-sign in. And you say, why do you do that if you're the one in there providing the anesthetic? We work in a team environment at UT Southwestern, so what happens is sometimes our faculty may be coming in as nurse anesthetists or advanced practice people, or someone may be giving you a break, and if someone comes in and you're signed in and it hasn't timed out, someone could pull out a narcotic and maybe give a partial dose or not all of it, but you're on the hook for it because you're the one that was bio-ID'd as being in on that Pyxis. So requiring that all narcotics that are pulled each time require a bioidentity actually associates the pulling of that narcotic or that particular scheduled drug with that person that had a bio-ID in order to get in. So that has helped us quite a bit. So bioidentity. So what happens in the operating room is once you picked your patient, the screen comes open, and we have about 3 or 4 drawers that will open automatically for us. It's unlike scheduled drugs where it will just pop out the individual medication. It'll actually have drawers that will open for you that have multiple medications in it, so that you can kind of cherry pick out of there what you need. But this is where I caution, and I made this big stop sign, because herein lies the big problem that we have. So you have all these drugs available, so it's our natural tendency to want to just pull them out, use them, do what we need to do, right? Well, this is where the big stop comes in, because as soon as you go to pick a medication out of those drawers, on this screen is a map, and the mapping shows what's actually laid out in that drawer, just like it is in that drawer. So they've made it so simple for us now that all you have to do is touch the medication that you're getting out, whether it's a Zofran or a Propofol or whatever it is you're getting. You can just touch it one time, and it will immediately dispense that or reconcile that to that patient, which is great, immediately, so that you're actually charging the patient correctly. So this is where we had a little bit of an issue, because people would would have a tendency to come in and just take medications out, and they would forget to touch the screen or actually charge that medication to the patient. So pharmacy would be having a discrepancy with all these missing medications from the Pyxis machine, and they weren't properly charged, and maybe not even documented, or sometimes they were documented on the patient's record. But it requires a lot of extra work on our pharmacy staff to have to go back and try to reconcile those records. So this is one part of it. But so once you've reconciled here, unfortunately, Pyxis has not created an interface system yet with electronic health records, despite which kind you may be using. Like we have Epic at our hospital, but there's currently not an interface that I'm aware of, and we've been working with several other hospitals looking at possible solutions to this that would communicate with our Pyxis and immediately pull it over into our macros. Like for instance, if I charged out the Zofran, it would communicate that I got Zofran out and put it on the patient's chart, and I would just have to chart the amount that I gave. It's currently not doing that. So it is somewhat of a little bit of a laborious process, because you not only have to charge it here, you also have to go over and make sure that you put it into the patient's electronic health record as well and document what you've given at that point. So it is currently a two-step process, and that is what makes it a little bit more tedious too for providers to make sure they're doing the right thing. So you ask yourself, we say, why are we wanting to do this, and what's the importance of it? Well, mainly for anesthesia providers and all of us, really, it comes down to our integrity. You know, as providers, we want to make sure that we're not fraudulently charging patients. We want to make sure that the patient's record is accurate. And the other thing is, inside of a day, you may do several patients, and even by the end of that day, it was hard to have a recollection of everything that you may have given in that particular case, or the case could have been a hurried case or an emergency case, and there's a lot of things that happen during that period of time. So it's very important that you take the time during the case. It takes a few extra seconds to make sure that you're tapping and touching the screen to charge, and that you're also charging in your patient's record, because that is a snapshot in time of what you did for that patient and care for them during that period of time, and you do want it to be an accurate reflection of what you did. So I like this, what C.S. Lewis wrote. He said, integrity is doing the right thing even when no one is watching. And I think that is so important as we look at what we do as providers. It's not always because someone tells us to do it, or administration says we have to do it, or that's what the federal guidelines are. We do it because we know it's the right thing to do as healthcare providers. We want to do the best thing for our patients. We want to have that integrity to know that whether someone's watching or not, that we're always doing the right thing by our patients. And so at the end of the day, when you take just that little bit of extra time to properly charge and properly document, then you don't have to worry about discrepancies, which takes us into our outcome of this would be that if you've taken the extra time to charge and to document, then you're not going to have discrepancies at the end of the day. So looking at what we're doing with charging, it's very important that not only you're charging the patient, but inside this Pyxis also, these are some few key elements we need to talk about. One thing is returning of medications. If you get a medication out with a patient and you did not use it, but you charged it, but it's not been tampered with in any way, or the seal broken, you need to go back in and return that to that patient, because if not, the patient's being charged, and pharmacy once again is looking through that chart to see if it's been used, and they're calling you because there's a discrepancy on charging but not charging to the patient because they can't see a record that it's been used. So it's important that you go back into that same patient, choose return, choose your medication, and then return it back, and it'll pop the drawer for you to put it back in there. Now, in the event that you've got a medication out, and when we talk about the word tamper, that I think conjures up a lot of different thoughts with people, but when we think about tampering in anesthesia, sometimes we'll pull something, we'll pop the top, or we'll break the plastic or open it. That is then considered tampered with, and we can't utilize that for another patient. So when that has happened, you have to actually go in and waste it. Now, that is a loss to the hospital, loss to pharmacy, and it's an anesthesiology loss charge. But what's important about wasting that is it shows that you did get it out for the patient, but that you did waste it, and so the patient will not be charged for that medication. It will be a loss, but at least it will be properly documented so it doesn't appear as a charge to the patient. The other important thing that we want to talk about is narcotic charging and wasting. Whenever you get out a narcotic for a patient, of course, you want to make sure that you're documenting on your record. And we have a few hard stops in our Epic system, so at the end when you go to PACU, we have a little flag that pops up to remind you to check your narcotic use so that you can make sure that you have documented. If you knew that you gave 100 mics of fentanyl, but maybe you've only recorded 50, it serves a little reminder for you to go in there and document that other 50 that you gave. If you didn't, however, it's important that you go into the Pyxis machine, that you have your nursing or some other licensed witness that will witness that wastage of that narcotic in the Pyxis machine, so that's first and foremost. But another good safety and fail check for anesthesia is in our Epic system you can make quick notes. So you can make a quick note anywhere in the record that would state that you gave 50 mics of fentanyl and you wasted the other 50 mics in the Pyxis with a licensed provider for witness. So it's sort of it gives a double check. It's also documented in the Pyxis for pharmacy, but it's also documented in your record that someone realizes that you just didn't forget to chart it, that you actually gave what you intended to give and you wasted the other amount that you didn't use. Transferring one group of medications to another patient, this is a unique I guess phenomenon with anesthesiology, because sometimes we'll go set up a room, we're ready to go, and for some reason or another the patient either ate, they were an NPO, or for some reason the case cancels or gets delayed. But just because that happens, the room will go on to the next patient, or we'll move another case into that room. And when that happens, many times the anesthesia setup is very similar or the same from one patient to the other. So let's say that Mrs. Jones was the one that canceled, but Mr. Smith is now coming into that room. And if those medications are clean and you've not in any way contaminated them, you can go in and pick Mrs. Smith, and there's a key tab on the screen that says transfer, and you can hit transfer, highlight all the medications that you want to transfer, and then it will give you another prompt screen to allow you to choose Mr. Smith, and you will transfer those patients over to him. And once again, you have alleviated the charges for Mrs. Jones, who didn't come to the operating room, who didn't need to get those charges, and you will have put those charges now over to Mr. Smith, who's going to be coming into that room later for anesthesia. So there's a lot of unique ways that we're able to document and reconcile our medications in the operating room and do it effectively and efficiently without having to even leave our operating room during a case. And so I think these little pearls are very important, but it will prepare you as you go out as a new hire at UT Southwestern and you have a preceptor, that you know that these tools are available to you to take that little extra bit of time in order to document, to be able to properly charge your patients and accurately document in the Pyxis machine. So at the end of the day, you don't have this crazy beeper situation going off and you look down and we laugh and we say it's Suma calling, who works in pharmacy, because she's looking for you to reconcile some drug discrepancies that you have that maybe could have been from days ago and you've already forgotten. So if you just take that little bit extra time, like we said, integrity is doing the right thing even when no one's watching, and make sure that you're doing that each and every time for every patient, then it will keep you from having these discrepancies so that you won't be someone that's having those issues. I appreciate your time today and allowing me to share this video with you, and I hope that you found it helpful and that it will help you be a little bit more mindful in your practice to do what's right for your patients. Thank you.